So by way of update, globally, we know that more countries are reporting cases of COVID-19. Here in our city of Toronto, we are actively monitoring 11 positive cases of COVID-19. These people are currently at home and in self-isolation. To date, overall, we have had 14 cases of COVID-19 in our city. 3 of these individuals have recovered from this illness. Late last night, my team and I learned that 2 Toronto residents were confirmed positive for the COVID-19 virus. One of these individuals is a man in his 50s who traveled from Iran and arrived in Toronto on February the 27th. He presented to North York General Hospital's emergency department on March the 3rd. He was assessed there and is currently in self-isolation. The second individual is a man in his 40s who traveled from Las Vegas and arrived in Toronto on February the 28th. He presented to Toronto Western's emergency department on March the 4th and is at home self-isolating. It's my understanding that all hospital protocols were followed for both of these cases. My staff have been following up directly with these individuals and all known close contacts of these individuals to understand the full details of those particular situations and the people that they may have come into contact with. Through our contact tracing, our understanding is that the man in his 40s, the one I've just told you about, had symptoms from March the 2nd to March the 4th and used public transit daily to commute to and from work. I want to be very clear. I have spoken with our colleagues at the Ministry of Health. I have also conferred with colleagues at Public Health Ontario. Public transit use in this particular circumstance and the exposure with respect to public transit is considered low risk. That's very important for you to note. So at this stage of the game, what I am advising you of, the information that I'm providing you with, is provided in an abundance of caution and in keeping with the commitment I made to the people of this city to share information that I have as quickly as possible and as freely and openly as I can. So when I have information, you are receiving it too. So let's go through the particular circumstances. The transit routes for the commute that I'm speaking of are from Bathurst TTC station westbound to Islington station around 8:50 in the morning on the days that we're speaking of. This is March 2nd through 4th. Also from Islington TTC station to the individual's workplace using the 108N Mississauga Way or My Way Express bus. With respect to travel home from the workplace, the individual's commute included the 27 Milton Go bus, and this is from the workplace to Yorkdale TTC station. That travel occurred at 6:10 on those evenings. And from Yorkdale TTC station to St. George Street TTC station. And again, the relevant time is around 6:45. Let me be clear, I've provided you with some times. These are estimates with respect to time, and we're working through with the individual with respect to getting very specific information. The final part, I should say, of that commute home involves transit from St. George TTC station to Bathurst TTC station. And again, this is the evenings around 6:45. Other public transit, specifically on March the 4th, included a ride from Bathurst TTC station to the 511 Bathurst streetcar. And again, as we get more details, as we are able to confer further with the individual in question, we will provide details as they become more available, more details as they become available. So this is the current local update. And again, I want to remind people that with respect to public transit, this information is being provided out of an abundance of caution. We are talking about low-risk situations, and we are actively following up, as we do with every case of infectious disease in this city, to understand what the circumstances are, who might have been exposed, so that those individuals can then do the appropriate follow-up to minimize any risk in our community. Looking nationally and looking globally, because we are seeing more cases, both internationally and in other Canadian jurisdictions, including BC, we anticipate and we are prepared for local transmission. You probably have heard through various reports that the Public Health Agency of Canada has updated their advice recently and currently is advising people that have a recent history of travel in Iran to self-isolate for a period of 14 days after their last day in Iran. This is similar to the advice being given to individuals who have traveled to Hubei province in China. Toronto residents who have traveled in these areas are asked to call Toronto Public Health at 416-338-7600 within 24 hours of when they arrive in Toronto, so that we can provide them with appropriate support and further instructions. But overall, my advice to the general public, including those who use public transit, is if you have no symptoms of respiratory illness and you do not receive a call from us or another local public health department, then you do not need to seek health care. If you are sick with respiratory symptoms for which you would normally not seek care, but can manage your symptoms at home with rest, then I would encourage you, please stay home and practice good general infection prevention and control advice, as we normally advise you to do during the cold and flu season. Things like washing your hands frequently with soap and water, covering your cough and sneeze, all the good respiratory advice that we know of and that we regularly communicate on a yearly basis. This is what those individuals should be doing. If you do develop symptoms of respiratory illness and you find yourself in a circumstance where you would normally seek health care, then please call ahead to your healthcare provider to let them know about your symptoms before you seek that care. That way, appropriate advice and precautions can be taken. So as I've already mentioned, we learned the details and were informed of these 2 new Toronto cases late last night. My staff have been following up directly with these individuals and their close contacts, and we will continue to do this. I will, as I have undertaken before, share more information as facts are confirmed. This all being said, since we as a community have learned of COVID-19, I have been impressed with how our community has been responding by increasing good infection prevention and control activities like hand washing and staying informed using credible information sources. And I ask you to continue to take this very responsible approach. At Toronto Public Health, my team is carefully monitoring the situation and have continued to work each and every day on this matter since we first learned of COVID-19. We are also expanding our public health operations as our local situation changes. We're actively working with our city and health partners to plan for the potential of local spread. The Office of Emergency Management is actively engaged. Our pandemic working group here at the city has been convened, and all frontline city divisions and agencies are refining their plans to further prepare. We continue to carefully monitor this matter. Given that this situation has impacted businesses globally and also has the potential to further impact our economic climate, we have developed guidance that is being posted on our website today, and we will continue to work with the local business community and share advice. As March break approaches, there are many events that will soon be taking place in our community and that may also involve travel. So we would recommend that all those who are considering travel during the March break should absolutely inform themselves, stay informed as to what's happening, and to make sure that you do check the Public Health Agency of Canada's travel notices and advisories. When planning events, for those who are planning events, you may consider things like, are people attending the event and coming from regions of the world where there is community transmission of COVID-19? You may also wish to consider, are people attending the event from a particular demographic group that is at greater potential health risk from COVID-19, like older adults? I would encourage event organizers to visit our recently updated website for more details on this as well. For large gatherings, event organizers should be facilitating good hand washing and good hygiene. They should advise people to stay home if they're sick and consider other measures, such as offering virtual or live streaming options and activities instead of face-to-face meetings. I have also been asked what actions schools can take to prepare themselves if our local situation changes. There are recommendations available based on the current COVID-19 situation for school administrators for the kindergarten to grade 12 population, which were recently released and are available on the Toronto Public Health website. Finally, I have also been asked what actions people can take to prepare themselves if our local situation changes. In answer to this, I think it's helpful for people to consider the supplies that they may need at home if they were to become unwell with any illness, not just COVID-19. For families, this may mean considering your household needs and how you might address those household needs if you or someone in your household were to become unwell. Things that people may consider include having supplies on hand so that you don't have to leave home if you become ill. You may also wish to consider how to manage childcare and other important household considerations. As I've said before, I think it is perfectly understandable that when there are uncertainties, people get concerned and people may worry. But I am here again today to assure you that based on the lessons we learned from SARS now 17 years ago, and given our experiences with the flu pandemic of 2009, and more recently with Middle Eastern respiratory syndrome, we have learned, we have shared knowledge, and we have built a stronger public health system that is ready to respond as needed. I also want to assure you that the city is well coordinated to respond. I encourage people to go about their regular lives, but stay informed. For me and my family, we will continue to go about our regular routines and activities, and this includes using public transit on a daily basis. We will also, in my family, continue to stay informed and follow all the advice that we are receiving from credible sources. We will continue to update our website toronto.ca/coronavirus regularly as new facts are confirmed. Residents who have questions can also call our hotline at 416-338-7600, and that operates Monday to Friday from 8:30 in the morning to 8 at night, and on Saturday and Sunday from 10 o'clock in the morning to 6 in the evening. Very good place to have your questions addressed. And again, I can't emphasize enough how we are keeping our Toronto Public Health website, toronto.ca/coronavirus, updated with information. With that, I will thank you for your attention, and I will now turn it over to Mayor Tory.